Welcome to the deep dive. Today we're looking into something quite a few of you with older cats might be familiar with or perhaps worried about: feline hyperthyroidism.
It's really common, probably the most common hormone issue we see in senior cats, actually.
And it seems, well, more complex than just an overactive gland, right? We want to really get into what causes it, the signs, some subtle, some maybe not so subtle, how it's diagnosed, and importantly, the treatments.
Exactly, and the potential complications, too. We've looked through quite a bit of veterinary information, various overviews to get a solid picture.
So our goal here is to give you a clear, comprehensive understanding, to sort of empower you with the essential knowledge you need.
That's the plan. So maybe the best place to start is the fundamental question. What is feline hyperthyroidism in simple terms?
Right, let's get down to it. What is it?
Okay, so as I mentioned, it's the top endocrine disorder in older cats. It basically means their thyroid glands, located in the neck, are pumping out too much thyroid hormone. We're talking T3 and T4 hormones here.
And why does that happen?
Well, in the vast majority of cases, probably around 95%, it's because of a benign growth on one or both glands. It could be a single growth, an adenoma, or just a general overgrowth of the thyroid cells that's called adenomatous hyperplasia.
Benign, so not usually cancer.
Correct. It's much rarer, but sometimes it can be caused by a malignant thyroid carcinoma. But typically we're dealing with those non-cancerous changes.
Okay, so mostly these harmless R growths are the issue. What actually triggers them then? And are certain cats just more likely to get this as they age?
Yeah, the trigger is usually that benign adenoma or the hyperplasia we just talked about. As for risk factors, the single biggest one is definitely age. We mainly see this in cats over 10 years old.
Uh-huh.
Interestingly, there doesn't seem to be a strong link to specific breeds or whether the cat is male or female.
Really? No particular breed?
Not that the current evidence strongly points to. Now, the sources do mention potential influences from environmental factors and possibly diet, but exactly how these play a role, well, that's still being researched. It's not entirely clear-cut.
Got it.
Hmm.
So primarily age. Now, once those hormone levels start to climb, what's the effect inside the cat's body? What sort of domino effect does it kick off?
It's like their whole metabolism gets stuck in high gear.
Yeah.
Excess thyroid hormone ramps up their basal metabolic rate. Think of it as their internal engine running way too fast all the time.
Okay.
And this has knock-on effects everywhere. Take the heart, for instance. Cardiac output increases, the heart rate goes up, and the heart muscle itself needs more oxygen.
That sounds strenuous.
It is. Over time, this extra workload can actually cause the heart muscle to thicken. It's a condition called hypertrophic cardiomyopathy, or HCM.
HCM, right. I've heard of that. The muscle gets bigger but less efficient?
Exactly. It becomes less flexible and can struggle to pump blood effectively. So that's a major consequence.
Okay, that makes sense. And what about their weight? Because often you think illness means less appetite, but that's not quite the story here, is it?
No, it's often the opposite, and that's a really key, sometimes confusing sign. That super high metabolism means they burn through calories like crazy.
So they lose weight.
They lose weight, often quite significantly, despite having a normal or even ravenous appetite. Their body is just burning energy too quickly, almost inefficiently.
So eating more, sometimes a lot more, but still getting thinner. That's definitely a major red flag for owners to notice.
Absolutely. That combination is highly suggestive. We call the increased appetite polyphagia.
Polyphagia.
Right, and that increased hunger is a direct result of the body's higher energy demands.
Makes sense. What are some other behavioral changes or signs that might crop up?
Well, alongside the weight loss and polyphagia, you often see hyperactivity. The cat might seem restless, pacing, maybe more vocal than usual.
Agitated.
Yeah, agitated, sometimes even irritable or showing uncharacteristic aggression. They just seem wired.
Okay.
Then there's often increased thirst and urination. You might notice the water bowl emptying faster or the litter box needing more frequent changes. We call that polyuria and polydipsia, or PUPD.
And why does that happen? Is it the kidneys?
It can be partly due to increased blood flow through the kidneys caused by the thyroid hormones. But importantly, it can also signal underlying chronic kidney disease, or CKD, which is also common in older cats and can sometimes be sort of unmasked by treating the hyperthyroidism. We can circle back to that.
Okay, yeah, let's pin that. So weight loss with increased appetite, hyperactivity, drinking and peeing more. Anything else on the list?
Some cats develop gastrointestinal issues. Vomiting or diarrhea can happen because the whole digestive system is sped up and can become irritated.
Right, the hypermotility.
Exactly. And then there are the cardiac signs we touched on. You might notice a very fast heart rate, tachycardia. A vet might hear a heart murmur during an exam, or sometimes even a specific extra heart sound called a gallop rhythm. These are all related to the strain on the heart, including that potential HCM,
Hmm.
other things. Sometimes their coat condition deteriorates. It might look dull, unkempt, maybe even greasy or matted, and you might see an increased respiratory rate, perhaps even panting, which is unusual for cats.
And I think you mentioned something the vet might feel.
Yes. Often during the physical exam, a veterinarian can actually palpate or feel an enlarged thyroid gland in the cat's neck. It feels like a small lump, sometimes described as a thyroid slip. It's not always palpable, but finding one is another strong clue.
Wow, it's quite a collection of potential signs.
That
It
is
really
true.
sounds like diagnosis isn't just one single thing, but putting pieces together. How does a vet typically confirm it?
You're right. It starts with the clinical picture, the history from the owner, and the physical exam findings, like feeling for that thyroid slip.
Uh,
But the cornerstone of diagnosis is definitely a blood test. Specifically, measuring the level of total thyroxine, or T4, in the blood.
Total T4.
Yes, a significantly elevated total T4 level in a cat showing typical signs is usually enough to confirm hyperthyroidism.
What if it's borderline, like high normal?
Good question. If the results are borderline, or maybe the cat has another illness that could be affecting the T4 level, the vet might recommend retesting later, or they might run a different thyroid test.
Are there other tests besides the total T4?
Yes. If things are still unclear, measuring the free T4 level using a specific method called equilibrium dialysis, often noted as FT4 by ED, can be really useful.
Free T4. How's that different?
Well, total T4 measures all the thyroxine, including what's bound to proteins in the blood. Free T4 measures only the active unbound hormone, which can sometimes give a clearer picture, especially if other illnesses are present.
Right.
And then there's a more specialized imaging test called thyroid scintigraphy.
Scintigraphy.
Sounds complex. It involves injecting a small, safe dose of a radioactive tracer that thyroid tissue absorbs. A special camera then creates an image showing exactly where the active thyroid tissue is, how big it is, and how active.
And why would you need that level of detail?
It's very helpful for confirming the diagnosis if blood tests are ambiguous. For identifying all the affected tissues, sometimes there's ectopic tissue elsewhere, and it can help distinguish between benign growths and the rare cancerous ones. This is especially important if surgery is being considered.
Right, for planning the surgery. Okay, so once it's definitively diagnosed, what happens next? What are the treatment options? Sounds like there isn't just one answer.
No, there are several main approaches, and each has its advantages and disadvantages. It often comes down to the individual cat, the owner's situation, and sometimes what's available.
Makes sense. So what's option one?
One common route is medical management with antithyroid drugs. The most common ones are methimazole, sometimes called Felimazole, or a related drug, carbimazole.
And how do they work?
They work by interfering with the production of T3 and T4 hormones in the thyroid gland. They don't destroy the abnormal tissue, but they block the hormone synthesis.
Okay, so it controls the problem rather than cures it.
Exactly. It's often used for long-term management, or sometimes just to stabilize a cat, maybe get their heart rate down, before doing a more definitive treatment like surgery or radioactive iodine.
What are the upsides and downsides of medication?
The big advantages are that it's non-invasive, just giving pills or sometimes a transdermal gel, and the effects are reversible if you stop the drug.
Reversible, okay.
The downsides, well, it requires lifelong, usually daily or twice daily administration, which can be a challenge for some cats and owners. And there's a need for regular blood tests to monitor the thyroid levels and check for potential side effects.
Side effects like what?
Things like loss of appetite, vomiting, lethargy are relatively common initially. Less common but more serious side effects can include liver problems, blood cell abnormalities like bone marrow suppression, or even facial itching, so monitoring is key.
Right. So that's medication.
Huh?
What about something more permanent? You mentioned radioactive iodine.
Yes, radioactive iodine therapy, or I-131, is often considered the gold standard treatment by specialists.
Gold standard. Why is that?
Because it has the potential to be a cure with just a single treatment, usually an injection. The radioactive iodine is selectively picked up only by the active thyroid cells, the ones causing the problem.
So it targets just the bad cells.
Precisely. The radiation destroys those overactive cells, including any abnormal tissue that might be elsewhere in the body, while sparing the normal, suppressed thyroid tissue and other organs.
That sounds ideal.
It often is. The advantages are that it's frequently curative, it's non-invasive after the initial injection, and generally has very few long-term side effects.
So what are the catches? There must be some.
There are practical considerations. Availability is one. It requires specialized facilities licensed to handle radioactive materials. There's also a period of hospitalization required afterwards, usually several days to a week or two, while the cat's radiation levels decrease to a safe point.
Right, for safety.
Exactly. And the upfront cost can be significantly higher than starting medication, although it might be more cost-effective in the long run compared to lifelong meds and monitoring.
Okay, so I-131 is a strong contender if feasible. What about surgery? Is removing the thyroid gland still done often?
Surgical thyroidectomy, removing one or both glands, is definitely still an option. It's often considered if only one gland seems affected, which we call unilateral disease, or maybe if I-131 isn't accessible or affordable.
And the main benefit is?
It can be curative, particularly if it's truly unilateral disease and the surgeon removes all the affected tissue.
But it's surgery, so there are risks.
Absolutely. There are the inherent risks of anesthesia, especially in older cats who might have other underlying health issues like heart or kidney problems.
Hmm.
And there's a specific potential complication with thyroid surgery, accidentally damaging or removing the tiny parathyroid glands, which sit right next to the thyroid.
Parathyroids, they
Yep.
control calcium. Right?
Exactly. If they're damaged, the cat can develop dangerously low calcium levels, hypocalcemia, which requires intensive treatment. Experienced surgeons take great care to avoid this, sometimes even auto-transplanting a parathyroid gland, but it remains a risk.
Okay, that's a serious consideration. Now, there's one more option often mentioned. Special diets.
Yes, dietary management using an iodine-restricted prescription diet. The main one available is Hill's Prescription Diet Yard.
And the idea there is to starve the thyroid of iodine.
Pretty much. Iodine is essential for making thyroid hormones. So by severely limiting the iodine intake, the diet aims to reduce the amount of hormone the overactive gland can produce.
Advantages?
It's non-invasive, just feeding a specific food, and it's generally well tolerated.
Disadvantages?
The huge disadvantage is that it's not a cure. It only works as long as the cat eats absolutely nothing else. No other cat food, no treats, no human food scraps, no hunting outside.
That sounds incredibly strict.
It is. Any significant source of iodine will undermine the diet's effect, so it requires extreme diligence from the owner and is often difficult in multi-cat households or for cats that go outdoors. It's generally considered more of a management strategy when other options aren't possible.
Wow. Okay, so quite a range of choices, each with significant pros and cons to weigh up with the vet.
Definitely a case-by-case decision.
Now, thinking long-term, whichever treatment is chosen, are there potential complications owners should be aware of, things that might develop later on?
Yes, that's really important. One major one is thyrotoxic heart disease, which we touched on earlier with HCM. Even after treatment, if the heart has already undergone changes due to prolonged high hormone levels, those changes might persist or could potentially lead to congestive heart failure down the road.
So monitoring the heart is still important even after the thyroid is treated.
Yes, absolutely. Another really significant potential issue involves the kidneys. Chronic kidney disease, CKD, is super common in older cats anyway.
Right.
Hyperthyroidism increases blood flow to the kidneys, which can artificially improve their filtration rate on paper, making kidney function look better than it actually is.
Ah, so it can mask underlying kidney problems.
Exactly. Then, when you successfully treat the hyperthyroidism and the thyroid levels normalize, that increased kidney blood flow reduces. And suddenly, underlying CKD might become apparent or seem to worsen. It wasn't caused by the treatment, but revealed by it.
That's crucial for owners to understand, so they don't mistakenly blame the treatment itself.
Precisely. It means careful kidney monitoring before and after treatment is essential. And finally, hypertension, high blood pressure, can be another complication. It can be secondary to the hyperthyroidism itself or linked to that concurrent CKD. So blood pressure monitoring is also part of good long-term management.
So it's really a systemic condition, affecting multiple organs. Okay, despite these potential complications, what's the general outlook? If a cat gets diagnosed and treated, what's the prognosis usually like?
Overall, the prognosis for cats with hyperthyroidism that receive appropriate treatment is generally good to excellent, especially with options like I-131 often providing a complete cure.
That's encouraging.
It is. The key really is that ongoing management and regular veterinary checkups. This allows for fine-tuning treatment if needed, like adjusting medication doses, and crucially, for catching and managing those potential complications, particularly the kidney disease early on.
Okay, so just to quickly recap the absolute key takeaways for everyone listening. This is a really common hormonal issue in older cats, usually over 10.
Mm-hmm.
Big signs to watch for are weight loss despite a good or even increased appetite, maybe hyperactivity or restlessness, and often drinking and urinating more.
Right. Diagnosis hinges mainly on a blood test for total T4 levels, though other tests like free T4 or scintigraphy might be used.
And treatment options are quite varied: daily medication, the often curative radioactive iodine I-131 surgery, or that strict iodine-restricted diet.
Each with its own set of pros and cons to discuss with your vet.
And finally, remember those potential complications, especially watching out for heart issues and unmasking kidney disease after treatment. But overall, the outlook is positive with good management.
Exactly. Recognizing those signs early and getting veterinary help makes a huge difference. And it is good news that we have several effective ways to manage this, tailoring the approach to the cat and the owner.
This has been incredibly helpful, really diving deep into feline hyperthyroidism. It's clear it's common, but definitely complex, needing careful, ongoing attention.
Absolutely.
Thinking about that potential dietary link, the iodine connection, it really makes you pause and wonder, doesn't it? What other environmental factors, maybe things we haven't even considered yet, might be playing a bigger role in our cat's health than we currently realize?
That's a fascinating thought. There's still so much to learn about how environment, diet, and genetics interact in feline health.
Definitely something to keep in mind and maybe discuss further with your own vet. Perhaps future research will uncover more about these subtle influences. Well, thanks for joining us for this deep dive today.